Good morning, it's October 27th, and this is your daily brief in science. Here's everything you need to know. A new study highlights a drug called 2-HDP that could protect the eyes of people with diabetes from vision loss. Diabetic retinopathy damages the retina's nerve cells and blood vessels due to high blood sugar, often leading to blindness. Researchers found that 2-HDP can neutralize harmful molecules that accumulate during the disease, potentially preventing further damage. Analysis of retinal tissue from humans with diabetes shows these toxic molecules are present, indicating a target for the drug. The mechanism of 2-HDP involves blocking molecules linked to disease progression and vision loss. This suggests it could be used early in the disease process to preserve sight. Currently, treatments focus on later stages, which can be too late for some patients. The study involved institutions such as King's College London, the Medway School of Pharmacy, and the Medical University of South Carolina. Computer simulations indicate that 2-HDP could be developed into tablets, making early intervention more accessible. Because the drug can easily enter cells, tablet-based treatments are a promising possibility. Developing early-stage treatments like 2-HDP could significantly reduce the risk of irreversible vision impairment in diabetic patients. Researchers at Ohio State University have created organic memristors using edible fungi like shiitake mushrooms, capable of processing and storing electrical states. These fungal-based devices are being explored as sustainable alternatives to traditional semiconductors, which rely on rare minerals and high-energy manufacturing. The study involved culturing, dehydrating, and electrically stimulating different parts of the mushrooms, revealing that various regions exhibit distinct electrical properties. Connecting multiple mushrooms in circuits improved their stability at higher frequencies, mimicking neural connections. These mushroom memristors are resistant to dehydration and radiation, and can operate as RAM at frequencies up to 5,850 Hz with about 90% accuracy. They can switch electrical states thousands of times per second, demonstrating durability across environments. The devices show promise for eco-friendly, brain-like computing systems, though their performance declines at very high frequencies. Their low power consumption and ability to combine memory and processing make them attractive for bioelectronics. The neural-like electrical properties, including adaptive signaling, suggest potential for neuromorphic architectures. Applications could extend to edge computing, aerospace, autonomous systems, and wearable devices, with ongoing efforts to miniaturize and improve cultivation techniques. Future research aims to refine cultivation methods and reduce device sizes, moving from small experiments to large-scale fungal component production as microchip alternatives. Ancient birch tar samples from alpine settlements dating between 4,300 and 3,500 BC are shedding new light on Neolithic life. Researchers found that the tar was chewed by multiple individuals, with some samples containing human DNA, allowing scientists to determine the sex of the chewers. Chemical and genetic analyses revealed a diverse range of plant and animal DNA, including domesticated species like wheat and barley, wild plants such as hazelnuts and beech, and psychoactive plants like poppy and flax. These findings suggest a complex diet and cultural practices among Neolithic communities. The study also uncovered sophisticated processing techniques, including multiple heating steps and the addition of substances like pine resin, indicating advanced technological skills. A team from the University of Copenhagen, led by Hannes Schroeder and Anna White, developed a new method to extract both genetic and chemical information from tiny fragments of birch tar. DNA analysis from tools and arrow tips showed evidence of hunting land animals such as sheep and wild boar, as well as fishing activities, based on fish DNA found on arrowheads. The genetic data also pointed to a possible gender-based division of labor, with male DNA mainly on tools and female DNA on pottery repairs. Overall, these tiny tar residues provide a detailed glimpse into Neolithic social organization, diet, and technological capabilities. A new study from the Karolinska Institute in Stockholm highlights the importance of early treatment for ADHD. Researchers analyzed data from over 148,000 patients diagnosed between 2007 and 2018. They found that initiating medication within 3 months of diagnosis can significantly lower the risk of serious adverse outcomes. The study emphasizes that medications like methylphenidate, commonly known as Ritalin, not only improve attention and impulse control, but also have a potential life-saving impact. Specifically, early medication use was associated with a 15% reduction in first-time substance misuse and a 25% decrease in recurrent misuse. It also lowered the risk of first-time suicidal behavior by 17% and subsequent suicide attempts by 15%. Additional benefits include a 13% reduction in first-time criminal behavior and a 25% decrease in repeat offenses. Traffic accidents saw a 12% reduction at first occurrence and a 16% decrease in recurrent incidents. The study notes that about 57% of diagnosed patients started medication within 3 months, highlighting the significance of early intervention. Overall, the findings suggest that early and consistent medication management can be crucial in reducing multiple serious risks for individuals with ADHD. Recent research suggests that brain response patterns could serve as biomarkers for psychosis risk, especially in individuals with schizophrenia. Participants who have schizophrenia but haven't experienced recent hallucinations show neural responses that are intermediate between healthy controls and those actively experiencing hallucinations. Professor Whitford emphasizes that understanding these biological markers could help predict who might develop psychosis and aid in creating targeted treatments. Researchers are investigating whether neural measures can forecast the transition to psychosis, which would allow for earlier detection and intervention in high-risk individuals. A study published in the Schizophrenia Bulletin found that in healthy people, inner speech reduces activity in the auditory cortex via predictive mechanisms. However, this reduction does not occur in individuals experiencing auditory hallucinations, where brain activity actually increases. This reversal supports the hypothesis that hallucinations result from the brain's failure to distinguish inner speech from external voices. UNSW Sydney psychologists' research provides evidence that hallucinations may stem from the brain's inability to recognize its own inner speech. These findings could help identify biological markers for schizophrenia, addressing the current lack of specific blood tests or scans. Developing such biological indicators is crucial for early detection and more effective treatments. The study used EEG measurements from 3 groups: those with schizophrenia experiencing recent hallucinations, those with schizophrenia but no recent hallucinations, and healthy controls, showing distinct neural responses during speech imagination and listening to sounds. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.